Attention Deficit Hyperactivity Disorder, ADHD, kids must learn through play. Sitting still hurts concentration and performance. Hyperactivity in kids with ADHD is not the factor which affects their ability to learn, rather it helps them to cope. A study from the University of Central Florida has found that when kids are free to move and play, they see a marked increase in the memory skills necessary for learning. The research shows that occupational therapists have been allowing kids with ADHD to express their hyperactivity rather than suppress it. Playing with small toys can keep ADHD kids busy. The toys offer a stimulating tactile experience, such as the playing with clay or spiky balls. The function of the toys is to let the kids' brains idly enjoy the sensation, while their executive functions focus on the task at hand. Dr. Mark Rapport, study co-author and head of the Children's Learning Clinic at the University of Central Florida, says the toys do sufficient job. Many children manage without medication if they are allowed to use non-disruptive mechanisms that facilitate movement. Unfortunately, acknowledging the needs of kids with ADHD is not the standard or sufficient. Prevalence of ADHD is rising year over year. For many of the kids, the sentiment they hear most often is to sit still and be quiet. The typical intervention's target is mainly to reduce hyperactivity. That's wrong. It's exactly the opposite of what we should be doing for a majority of children with ADHD. Rapport and his colleagues wanted to see how well playing actually enabled kids to perform better on certain tasks. They observed 52 boys, between 8 and 12 years old. 29 of the boys had ADHD, and 23 did not. Each boy underwent the same test. They gave a scrambled list of numbers along with one letter. They were told to put the numbers in order followed by the letter. A high-speed camera recorded their movements while they performed the task. The kids with ADHD performed significantly better on the task when they were free to engage in extraneous activities such as tapping their feet, moving their hands, playing with the objects around them. The test was designed to measure the boys' working memory, a component of executive function that relies on short-term memory to process and store information temporarily. Kids who had ADHD didn't show working memory scores typical of non-disordered children, but the improvements were clear. What was found is that when they're moving the most, the majority of them perform better. They have to move to maintain alertness. Kids without ADHD showed equal or worse performance when they were hyperactive. Tapping their feet, moving their hands, and playing with nearby objects actually distracted them rather than enhanced their focus. Contrary to popular belief, hyperactivity isn't omnipresent in kids with ADHD. It only seems to crop up when they need to use their executive functions, such as when they're making plans, solving problems, moving between tasks, and remembering lists or facts. In light of the new research, hyperactivity helps the kids in performing many tasks. Telling them to sit quiet, in other words, would only make things worse. In the future, the team hopes to take a closer look at what's really going on in the brain of ADHD kids. The research is moving into neuroimaging that will allow to identify executive function in children with ADHD on an individual basis, and to design cognitive interventions that pinpoint and strengthen affected areas.